opioid handout, I mentioned about pain pathways and how opioids act briefly. I want to further delve in a little bit detail about how the opioids act. I mentioned about opium plant being the poppy seeds being the origin of morphine and the derivatives that we use now. But how do you think these act, these opioids? Well, we have endorphins in our body. I'm pretty sure you have heard of endorphins being secreted when we exercise, like they call it the runner's high. They also say it's secreted when people have orgasms or when you eat, like sometimes even spicy food. I'm not sure if there's any literature out there, but endorphins and enkephalins are generally present in our body and are released due to certain stimuli. Maybe when we have a stressful stimuli or painful stimuli, in general, we have this neurotransmitter or a hormone neurotransmitter, which is secreted when in terms of pain or stress or even when we have exercise. So kind of they make us feel good. They kind of protect us from pain and make us feel good. So what scientists identified was that opium seeds can actually act exactly like these endorphins by acting on the receptors. Those, we call it opioid receptors now. Mu receptors are the receptors, mu1 if you want to call that, where these morphine acts. So when morphine or the opium seeds were found and they were tested on human beings, it was found that they activated the mu opioid receptors of the central nervous system that's in the brain, and they caused a reduced pain sensation, or in fact they nullified the pain. They did not take the pain away, but they just made the person feel less pain. So in other words, they also cause sedation, and because these new receptors are also present in the GI system, they slow down these receptors too and caused constipation as another side effect. Further, they also slow down the breathing by acting on the medulla oblongata. So now you can see how opioids were originally derived from and how they act upon. And based on these, you already know some of the side effects, right? Most importantly, because they give this feeling of high, they can cause dependence on patients. Not everybody, but up to 15%, that's 15% of the world's population, has a high risk for dependence. So there are two types of dependence. You need to pay attention here. It's physical and psychological. Physical dependence is when your body requires that medication, and if the body does not get that medication, it will go into withdrawal. Whereas psychological dependence is when there is a craving for that particular medication, and if the person does not get it, they will go to further extremes and manipulation and other ways to claim it, which can lead to addiction behavior, and they need more help to come out of it, right? Tolerance is when you need more and more, just like when you drink coffee, you drink some coffee, but then after a while that same amount of coffee does not work on you, right? Nausea, vomiting are also other side effects. Those are initially when patients are placed on opioids, they could have these side effects, but most worrisome are sedation, slowed breathing, or decreased respiratory rate, dependence, tolerance, addiction, and constipation is another new thing. So already you know as nurses what you have to focus on, right? Would you listen to them? Would you look at the respiratory rate? Would you give this drug at all? Do you think it's everybody's risk for addiction not to give this drug? Tell them not to stop it right away? Well, those are things that you have to think through. So, having talked about some of the side effects and as nurses what you might want to think, let's move on into the controlled substances or scheduled substances. If you look at this table, you have Schedule 1, 2, 3, 4, 5. Schedule 1 is not prescribed, it's illegal. You see here you have marijuana, you have heroin, but of course marijuana is medically more legal now in some states, but not all. Schedule 2 is one of the most commonly used class of drugs in the hospital setting. So if you work as a nurse in the hospital setting, you will see a lot of this medication used. I am going to talk a little bit more another audio in part 3 more in detail about these schedules and also some of the drugs, especially in terms of the analgesics. Tune in with me. Thank you.